Do you know what causes chickenpox? It's not a rite of passage or a childhood inevitability, but rather a highly contagious infection caused by a pesky little virus known as varicella zoster. This virus is a bit of a social butterfly, spreading from person to person with ease. Imagine this scenario. A person infected with the varicella zoster virus sneezes or coughs. Tiny droplets containing the virus are launched into the air, ready to be inhaled by anyone nearby. Alternatively, the virus can spread through direct contact, say, from touching the fluid from an infected person's chickenpox blisters. So the culprit behind those itchy red spots that we associate with chickenpox is not some mysterious force, but a very real, very contagious virus. Understanding this cause is the first step in managing, treating, and even preventing chickenpox. So if you've been wondering what causes those itchy red spots, now you know. It's the varicella zoster virus. But how do you know if you or your child has contracted this virus? Let's identify the symptoms. Chickenpox often starts with general feelings of being unwell. You might notice a fever, a sense of tiredness, a loss of appetite, or even a headache. But the real hallmark of chickenpox is the rash. It begins as small red spots that might not seem too serious at first. However, these spots quickly evolve into itchy, fluid-filled blisters. These blisters eventually crust over and turn into scabs. This rash typically makes its first appearance on the face, chest, and back before spreading to the rest of the body. It's a bit like an unwelcome houseguest that insists on exploring every room. Remember, chickenpox can be very contagious, so it's important to recognize these symptoms. Being aware of these symptoms can help you seek medical attention in a timely manner. Now that we understand the causes and symptoms, what can be done if you or your child contracts chickenpox? For most people, chickenpox is a condition that will improve on its own. However, there are certain treatments available that can help alleviate the discomfort of symptoms. Antihistamines, for instance, can be used to reduce the itchiness that is often associated with the condition. Paracetamol can also be helpful in bringing down fever. Staying well hydrated by drinking plenty of fluids is key to recovery as well. In severe cases, or for individuals with weakened immune systems, antiviral drugs may be prescribed. It's crucially important to remember that if you or your child has chickenpox, a healthcare provider should be contacted for advice. They will be able to guide you through the best course of action for your particular situation. Remember, while chickenpox is generally mild, it's always best to seek medical advice if you suspect an infection. To recap, today we've learned about chickenpox. It's caused by the varicella zoster virus and manifests as a fever, rash, and itching. Staying hydrated, getting plenty of rest, and using antihistamines and paracetamol can help manage the symptoms. Remember, if you suspect an infection, it's crucial to consult a healthcare provider. Knowledge is power, especially when it comes to our health. Stay informed, stay healthy.